I had a call from a recruiter. The LDS church decided to divest their hospitals. And I was given the opportunity to come up for an interview, and then they wanted to be my wife said, and I think she got me the job. They decided, we're going to give it as a gift, and we expect nothing in return financially. The only thing they asked was that with this gift comes a responsibility we expect you to accept. And that is that you will validate our decision by evolving Intermountain Healthcare, developing it into a model healthcare system. We received a magnificent gift, and we felt we really had to deliver. That was the beginning of Intermountain Healthcare and its core desire to be a model healthcare system.
Mother Xavier Ross handpicked 4 sisters, gave them a whopping $9, and told them to head west to care for the health needs of the people of the country. She did so, advising them that they should look forward to the good things that are yet to come. The sisters opened their hospital in a cottage, but soon moved to a brick building.
They were always charitable, especially to the poor and needy, and anyone who else maybe needed extra spiritual care, and took care of the whole person.
When you look at the first patient record and you see the types of injuries, right, gunshot wounds, illnesses, typhoid, you realize what the Wild West, was about. And so to create a space for people to come, a trusted place, was what the sisters really hoped for, just to meet the need, whoever that was, wherever it was.
The first thing they did for that first 10-year period was develop a system of hospitals that worked together.
In order to meet the charge of being a model health system, find ways to help keep people healthier, not simply taking people after bad things that happen to them in hospitals. That motivated us to move into insurance. And the goal was to really move upstream and be able to reach people before they became sick.
And then in '93, formed the medical group. And so there was a progression there that was so very exciting, so very meaningful.
We were the first group in the world to apply what later came to be quality improvement, the principles of quality improvement in healthcare delivery. We were massively successful around understanding clinical variation, then acting to appropriately remove it in ways that worked. It was a team effort.
Doctors, when I started practice, were not used to getting feedback about the quality of their care. Being able to go out and represent the clinical programs and kind of get over that hump of, you're giving me feedback? It was one of the things that I think was most important in terms of Intermountain having a physician group.
The first large growth piece was the direct primary care group in Nevada. One of the things that I really liked that we were able to do is to demonstrate that this keep people well style of healthcare could be done outside of the geography of Utah.
I remember there was a great deal of excitement amongst the Nevada team.
I think that the acquisition went pretty smoothly because we spoke the same language. We had the same values. We were here for the patients.
So today we're thrilled to announce that Intermountain Healthcare and SCL Health have signed a letter of intent to merge.
It became very clear to me as the chair of the SCL board that our values were extremely consistent, beneficial for both organizations, but more importantly, extremely beneficial for the communities we served in all the states that we were present in.
Intermountain is bringing something that the nation can learn from and follow, and it's not coming from a sense of arrogance, it's coming from a sense of results.
I am a so much better person. Not just a better professional, but a better person for associating with the people at Intermountain Health. People whose professionalism, whose selflessness, and who just from the standpoint of their example of integrity have inspired me to be a better person.
Never lose sight of the original goal. We heard it, we took the challenge, we worked very hard to accomplish it, and here are the results.
Someday, if I'm ever put on the witness stand, I'm going to have no trouble at all saying, we more than kept the promise.
That mission and charge continues to drive the organization today in the same way that I'm sure it inspired those who had responsibility to drive Intermountain from the beginning. And I expect that that same charge will be alive, well, and followed years from now.
I want to express appreciation to all of those who helped build what Intermountain is today. To each of you today who carry it forward, and to all future caregivers at Intermountain who will continue this journey and this legacy to assure we're delivering on our mission of helping people live the healthiest lives possible. I look forward to the next 50 years.